Diolch yn fawr iawn. Thank you very much for the opportunity to talk to you today. What a wonderful series of presentations and discussions we've had so far. My sincere thanks to Siwan for all the hard work. And not just Siwan, the title of the presentation that Jane was talking about is the partnership approach to what we're trying to do here in North Wales to support children's mental health and well-being. So it very much is a reflection of the partnership work that we've been doing as a public health team with partners for the last year, really. So, make sure I press the right button. I was trying to press it on here. Is that easier? I'll just do it that way. Right then. Okay, content. I'm going to talk to you today about 3 pieces of work, 3 projects that we've been doing to support well-being of babies, children, and young people and the families. The first one is in relation to perinatal mental health. And it's an innovative pilot project based in the community that we've been involved with in north of Gwynne, in Arfon, in the cluster. I'll talk a bit about that. The second one, continuing with the theme of perinatal mental health, is about how do we provide accessible, high quality and trusted information to both the public and to services around perinatal mental health. And the third one is a reflection on some of the work we've been doing. Great that Jane's just mentioned the Children's RPB there. There's a really interesting group of colleagues in the Children's RPB who've been working on something called the Emotional Health, Wellbeing and Resilience Framework, which is the children's version of the 5 Ways to Wellbeing. You can see Hannah over there. I think Hannah might have been involved in the work maybe a bit longer than I have as well. That's a really nice piece of work, and I'm glad to be able to share some of that with you today. Right, on to the first one. So, we've heard early on today and throughout the session, to be honest, about the importance of mental health in parents. And when we talk about perinatal mental health specifically, we talk about the emotional mental health and well-being of women and their children, the partner and families from pregnancy up to 1 year following the birth of the child. A really important period of time. Clearly, optimising perinatal mental health is important for the well-being of the parent, but as we've already heard about today already, it's a really important factor. Some nice Japanese music in the background there. A really important factor for infant mental health and the parent-infant relationship that we've already heard about a lot about already. So we talk about risk and protective factors in public health, don't we? If parents have good mental health and well-being, it is a protective factor for infant mental health, and the vice versa is true. Unfortunately, mental health issues in the perinatal period is not uncommon. Up to 1 in 4 women experience perinatal mental health challenges. That includes depression, anxiety and other mental health disorders, and these vary from mild to moderate to severe. And it's not just in women either. 1 in 10 men, up to 1 in 10 men, also face perinatal mental health issues. We had a question about the mental health of men and young men early on today. But these symptoms are often less recognised. We're fortunate in health boards to have funding from Welsh Government to support dedicated perinatal mental health services. However, there's only capacity to see women who have the highest level of need. And we know that a large proportion of women don't reach that threshold of severity of symptoms and therefore aren't offered the service that they could really benefit from that would have a huge impact on their and their child's well-being. So that's the problem that we noticed. And we had some local data that helped us understand the number or percentage of referrals that were sent to the specialist perinatal mental health service that weren't seen because they didn't meet the threshold criteria. So they come back to the system, managed in primary care, and because of the capacity not being there, that management wasn't optimal. So what do we do about that? We presented this data to a number of clusters, to GP clusters, and the one in Arfon, so that's the north of Gwynedd, went, we could do something about this. We need to do something about this. We can't sit with this risk and potential harm occurring. So they identified an existing mental health offer that was delivered by occupational therapists on that patch in Gwynedd and Anglesey. And they deliver mental health support in the community for patients reporting mild to moderate mental health distress. Patients can be referred by GPs, they can be triaged through GP reception teams, or referred by health visitors and other healthcare professionals. So the pilot did 2 things. It firstly recognised who's on our caseload at the moment in the OTs project that fall into the perinatal category, and really understanding the benefits of the intervention for them, but also involved additional referrals from the health visitor to this service in the community for women who didn't meet the severe threshold criteria. Patients are supported to explore meaningful occupations, and it was really interesting listening to the occupational therapists describe the interventions that they delivered in their community sessions. So thinking about life roles and activities, meaningful pursuits, things about connecting with each other and the social aspect of well-being that may provide helpful change to improve physical and mental well-being. The pilot ended in January, and we're just in the process of finalising the end evaluation of it, but we have been following women throughout in terms of case studies to make sure that the offer is acceptable and effective and not causing harm. That's the important thing. Using things like PREMS, which is patient-reported experience measures, other therapist-completed outcome measures, and tools like the Requal 10, which measures we can use as pre and post measures, basically, before and after the intervention. The feedback that we've had so far has been very positive, and significant impacts and improvements have been recognised for the women who have been referred. So we haven't got detailed evidence today to share with you. That will be coming in the next month or two. But we wanted to highlight this as an example of practice, working, using the power of data and evidence, holding that conversation in the system and figuring out together how is a system that we can respond. The service has been, the OT service is being funded through the cluster programme at the moment in that part of Gwynedd. There are issues, of course, with ongoing funding of interventions, but we need to work together to make sure the evaluation is robust enough so that if something does work and we can evidence that clearly, that we can make a strong case for continuation and rollout, if that is what we deem to be appropriate. So that's the first project. The second one, still on the theme of perinatal mental health, involves the provision of trusted, accessible information and advice, both to the public and to families, but also to service providers. Providing trusted and accessible advice and information for the public on perinatal mental health should form a core part of our offer to parents. It's the foundation around prevention, early intervention. People go looking for information. We know that the NHS is a trusted source of information for parents. However, we did review our content on the Health Board's web pages, and there was a clear need for improvement. So what did we do? We set up a task and finish group with a broad range of partners. Again, the theme today is about co-production and collaboration. And we were fortunate to be able to work with Maternity Voices North Wales, who has a really broad representation on that group, lay members, professional colleagues as well, and tested out and co-developed the content for this new resource. It's called the Perinatal Mental Health Hub. I'll give you a glimpse in a second of where that sits on the Health Board's website. You might be aware of it. So these are the components that we have developed to talk about perinatal mental health. So preconception and mental health, we've had some conversation on preconception already, and that is important that we have that conversation with parents when they're planning potentially a pregnancy. What does that mean for them and their mental health? Understanding perinatal mental health and emotions, anxiety during the perinatal period, antenatal and postnatal depression and treatment, psychological effects of birth trauma, baby loss and bereavement, postpartum psychosis, and information as well about how people can help themselves and how friends and family can offer support. These have been really well received. And they form part of what we call the Best Start Hub, which is a more universal resource for families around all kinds of things to do with providing the best start for children. That's the screenshot for Best Start. We love our QR codes here, don't we? So please take a picture if you like, or just Google Best Start BCUHB, and that information is all there. So we know that providing, like I was saying earlier, reliable, trusted advice and information on these important issues is an important part. It's not going to solve the problems for everybody, and we had that conversation in the room earlier about, providing more and more information isn't the answer all the time, but we want to make sure that our baseline offer is robust and acceptable. But we didn't stop there. We recognised as well, in the conversations that we were having with service users in developing this resource, that there was a bit of a gap and a bit of a training need in terms of the frontline staff that were working with families and their awareness of perinatal mental health and what they could do. So we also developed new content on our intranet page. It's called BetsyNet. So staff can access that. It's high quality, trusted again, information for staff to act on. And also a Padlet. That's the scrolly bit that's going up on the screen there. Is it scrolling? Yes, it is. I'm really pleased with it's not my IT skills at all. It does increase the file size rather too much, to be honest. But these resources are really helpful. I think that's the advice we've had from services in terms of being able to access this on the go if they've got their phones or their iPads or however they work when they're out in the community supporting families. These are resources they can access at the click of a button, and they found it to be really helpful. So there we go. That's the second project I want to talk about. And the third and final one is really interesting, and it ties in with lots of the discussions we've had today already, is a children and young people's version of the 5 ways to well-being. And I'm sure if I asked you, how many people are aware of the 5 ways to well-being, I'm not going to ask you to put your hands up, but you can if you want. These were developed from evidence from the Foresight report in 2008, but they're developed for an adult audience. So what does connect mean? What does be active mean for me in my 40s? And what does it mean to a 3-month-old or a 6-year-old? It's going to be very different. So colleagues in the Children's RPB embarked on a really ambitious piece of work to work back from the content of the 5 ways and develop a version that's meaningful to children of different ages or different developmental stages. And there's a link to it there, and it's called the Emotional Health, Wellbeing and Resilience Framework. So the design process, again, the theme of collaboration and co-production is very much true here, engaging with colleagues from education, children's services, NHS services, as well as young people, parents and carers, and the third sector. So a real partnership effort to develop the content and a thorough process, robust process to do that in terms of making sure that the information was evidence-based. The output, I'll show you a screenshot of the framework in a second. Apologies to all of you who might be very familiar with this already. The output is framed as what the core skills and behaviours mean for connecting, for example, what they mean from the perspective of the child, the parent or trusted adult, and then finally support services. So it gives us a whole picture of what this objective means for the system. So the framework is a matrix. We've cut the 0 to 18-year-old category into 5 sections, 0 to 3, 4 to 7, and so on. Up to 18, we are considering developing a new section up to 25 to align with the education practice that we need to do. We have had conversations that age categories aren't particularly helpful. It's about developmental categories. So in future work, we might take a step back from categorising this by age and thinking about where is a child now, thinking about the fact that children develop at different ways, in different times. We have trialled and funded through the RPB funding tests of change, and they're being evaluated at the moment. So, for example, teachers in some schools have piloted this in sessions such as parents' evenings. So when they need to have potentially quite difficult conversations with some parents around their child's behaviour, or they've got a concern about development, they can use the framework to help not only understand how they can support it even further in the school, but also what role parents can play in supporting the well-being of their child. So this screenshot here is one from Connect, from 0 to 3-year-olds. So as I said earlier, the core skills and behaviours on the first column. So for example, beginning to understand how to interact with others, so connecting, 0 to 3. What does that mean from the perspective of the child? I'm beginning to interact with people familiar to me. Very simple statements, clear statements. The next column talks about the role of parents and trusted adults. So that's saying we will provide opportunities for our child to socialise, and we model and support our children to interact and play well. So it's that role modelling piece there. So it's helpful to services who've trialled this, that's the feedback we've had, to use the language in here to prompt a different discussion with parents. Have you thought about role modelling? What kind of, and leading into that kind of conversation. And then support services. We provide opportunities for children to learn and develop their social skills in a variety of settings. When doing this, we model language and play to develop emotional literacy. This has landed really well in the system. However, we could quickly see that this, as it looks at the screen at the moment, isn't a very helpful public-facing resource. It's mainly for professionals. So we recognise that, and we're working to address that. So we're developing a new website specifically for this work. That's a still screenshot from some animation that we're doing. So how do you bring the 5 ways to life in terms of storytelling? We know storytelling works really well. So those animations are already there. There's a hyperlink. So hopefully we can share the slides after the presentation today. We also, in terms of innovation and sharing some of the learning, we hosted a placement for 2 speech and language students in the public health team a few months back, which went really well. And we made the most of that extra capacity, and they helped us undertake some focus groups with services, earlier settings, to really understand what do we need to be really thinking about carefully as we try and translate that complex framework into something much more friendly for the public and for parents. And what came through in that focus group work was play. Play came through really strongly as a means through which we can really integrate the 5 ways to well-being together, because they don't sit in isolation, the 5 ways. We don't connect and not learn and not take notice and not be active. Quite often they're banded together. So play came through really strongly. So the focus in the first phase of these new resources is going to be around play and connecting, helping to connect families and communities to assets in their community, parks, playgrounds, beaches and so on, things that are low cost. So the impact of poverty came through so very strongly as we would have anticipated. How do we connect communities with assets on their own doorstep? And using the framework to help enrich those experiences about looking at nature changing, taking notice of nature, connecting with new people, connecting with friends and family, being active and so on. So we will hopefully be working towards a soft launch around Easter with this first phase. Out and About is the title of the first piece of work. And then hopefully working towards a more formal launch, or RPB colleagues will be doing that, maybe in the Eisteddfod in Wrexham towards the end of the summer this year. So we look forward to sharing more of that as that matures. So thank you for your time. I'm happy to take questions at the end when that opportunity lands. Diolch yn fawr. Thank you.